Hi, I'm Angie Davis, a physical therapy assistant and personal trainer at Total Rehab Care at Robinwood for Meritus Health. Today we're going to talk a little bit about the core, the importance of the core, and some exercises that will help strengthen up the core muscles. You need to engage the muscles of the abdominal area, the sides of the body, the low back, as well as the muscles around the pelvis itself. These muscles, if working in congruency together, will help a lot with increasing your balance, your stability, your postural awareness, as well as decreasing low back pain and increasing your overall function and mobility. The first exercise we'll do is what we call a bridge. So what you'll need to do is lay yourself down. You want to make sure you suck your belly button to your spine. Holding that tight, you can even put your hands down on the surface. You just want to lift your bottom up off the mat, hold it for a count of 5 seconds, and then easy back down. And I would say start off with doing about 10 of those, progressing up to doing at least 20 or even 30 if it feels okay. From there, you could do some lower abdominal work called double knee to chest. What that is again, sucking the belly button into the spine, knees up, knees back down. If that's too aggressive for you and it causes increased back pain, you can do one at a time. And then you can also alternate between an opposite arm and leg, again, still keeping the tummy muscles tight. From that, you can go into a side plank. Now to start off, you can have the knees bent, elbows going to be underneath of you. Again, belly button's nice and tight. You're going to bridge up. When you do, you should feel these muscles right on the side of your body, the oblique muscles getting nice and strong. You're going to hold that as long as you can. You may start off with 5 seconds, you may progress up to 30 seconds, and then easy back down. From there, you'd go into your plank, and we'll show you modified plank first, just because maybe you can't do the full-blown plank to start off with. So what it is belly button sucked into spine, elbows are underneath of you, knees are bent. Again, hold it as long as you can. And as this starts to get easy, then what you would do is lift your knees off and go to your toes. Always keeping your head straight down and your back nice and flat. No rounding and no arching, nice and tight. Then from there, you can also do what we call swimmers, where you'll move your opposite arm and leg. So, your head will be straight. Some people may want to put a pillow so they're not suffocating themselves. So you're going to go opposite arm and leg just to really engage all those muscles down the spine. And then a progression of that is to go up on all fours, belly button still sucked in nice and tight, opposite arm and leg. Again, start off, maybe you can only do 5 at a time, progress to 10, go up to 15 and 20. And those are some basic exercises to help strengthen up your core. To do these exercises, you want to make sure you have a firm surface. You could do them on the floor if you have a mat or something sturdy. If you can't, doing them in bed is okay. You just have to be aware that sometimes the mattresses are soft, so they may give you a little bit more of a challenge as far as that's concerned. But the big important thing is always suck belly button to spine. Thank you today for joining us at Total Rehab Care at Robinwood. If you need more exercises or would like a list of the exercises we did today, you can go to meritushealth.com.